So today we will talk about communication process. There are different components of communication process and they include sender, receiver, the most important thing, the message, channels of communication by which the message is conveyed, and feedback. If we align all these components, we will get a model known as Shannon-Weaver model. Now, talking about different channels of communication, there is interpersonal means, there is mass media, and there is folk media. Interpersonal communication is between two persons or a group of people. Mass media is by television, email, print media, and other forms. Folk media includes the passage of stories in the form of cultures from one generation to another. Talking about different types of communication, there are 8 types. Number 1, one-way. For example, when a person is giving a lecture, two-way is the question and answer session. There is verbal and non-verbal. Verbal includes with words and non-verbal, that is sign languages. Formal when you're talking to your superior, and informal talking to his friends. And then there is visual and telecommunication. By all these types of communication, a message is conveyed from a sender to a receiver, and then he will give you his feedback. Now, all of these concepts are interrelated in a model known as Shannon-Weaver model. Now, talking about different methods which are used in health communication to convey message regarding health. They include individual approach, further subdivisions, that is personal contact, and doctor-patient relationship. Now, whenever a patient is ill and he has come to you, he will be in a state to have a better understanding what advice a doctor will give him. So this is a very important way by which health-related education can be conveyed to people. Another approach is group approach, which includes lectures, demonstrations, panels, symposiums, workshops, and role-playing. Another approach is the mass approach, and that includes the conveyance of message through TV and radio, internet, newspaper, print media, posters, and exhibitions. Despite the presence of numerous methods, there are still a number of barriers in conveying these messages, and they include physical, social, religious, cultural, psychological, economical, and environmental. Now let us talk about the functions of health communication. The first function is to spread information. What this information will do, it will decrease misconception and it will increase awareness among people to develop more and more healthy attitudes and behaviors. Education. When a person gives education, it will increase the knowledge not only of the other individual, but eventually through his attitude and behavior, it will be transferred to the whole community. This is very important. Another thing, that through this health communication, the people will become more motivated, more persuasive, they will require counseling, but eventually they will have an increased morale and they will not only be healthy, but they will help in developing a much better health organization. Talking about different stages of health education, that by what steps actually delivering the message of health education can be made easier and more effective, and they include sensitization, a lot of publicity, educating the people about things, and this will result into attitude and behavioral changes. They will become more and more motivated, and they will eventually take part in more and more community work, and a whole community will eventually become healthy and it will undergo a process of transformation. Now, there are different contents of health education. By this we mean that there are different points about which we must educate people. They include nutritional education, it includes hygiene, family-related health education, disease prevention and its cure, mental health, prevention of accidents, provide information to everyone regarding every important thing related to health. Now let us finally define health education. By health education, we mean a process of informing and helping people to adapt a healthy life and advocate environmental changes which are needed to reach this goal and to conduct professional training and research. Further talking on health education, it has certain principles which one must be aware of, and they include credibility of information, and that information should develop in trust in people so that they take participation, they become motivated, and the health education or information regarding the health should be very comprehensive. There should be use of different reinforcement to make people more interested in this, and learning by doing, that educate people that these are the things which will help you acquire a healthy lifestyle and good human relationships, a feedback, and leadership qualities. So through these principles of health education, the information regarding a healthy lifestyle should be conveyed, integrated into the community so that a community as a whole transforms.